In today's topic, we will discuss about hormones which are secreted from posterior lobe of pituitary gland. There are only two hormones which are secreted from posterior lobe of pituitary. One is oxytocin and another is vasopressin antidiuretic hormone. Now about oxytocin. Oxytocin is a peptide hormone. It is synthesized in the supraoptic and paraventricular nuclei of hypothalamus along with vasopressin, and it gets stored in the posterior pituitary. There are stimuli which cause the release of this hormone from posterior pituitary are like parturition, that is postpartum period, suckling by infants and coitus. And then there will be release of oxytocin. Now coming to the pharmacological action of oxytocin. As we its action on uterus is its oxytocin stimulates the contraction of the pregnant uterus. It increases both the force and frequency of the uterine contraction. It only contracts only body and fundus of the uterus. In early pregnancy, uterus is resistant to oxytocin. High dose of oxytocin is required to stimulate the uterus. As the pregnancy continues and near the term, the sensitivity of uterus to oxytocin increases, and with a sharp rise near term. Oxytocin increases both frequency and force of uterine contraction. How does its mechanism of action is oxytocin binds to specific G protein coupled receptor. There is a generation of inositol triphosphate, and then there will be release of calcium, which will increase the production of prostaglandin by endometrium, and which causes the contraction of the pregnant uterus. Action on breast. It contracts the myoepithelial cell of breast, which causes milk ejection. On kidney, at high doses, kidney acts as an antidiuretic hormone, but it acts as a mild antidiuretic. It decreases uterine output, and water intoxication may occur if large amount of fluid is administered along with oxytocin. Preparation and route of administration. Oxytocin is not effective orally since it is a peptide. So synthetic oxytocin is commonly used, and it is administered as IV infusion or intramuscularly. The preparation which is available of oxytocin is cyanotomentary. That is cyanotomentary. Now the uses of oxytocin. Oxytocin is used for the induction of labor. It is a drug of choice for induction of labor, and it is administered by IV infusion. The starting dose should be low, and the rate of infusion is monitored and according to the response. During oxytocin infusion, uterine contraction, maternal blood pressure, fetal and maternal heart rate should be monitored. Why oxytocin is preferred for induction of labor? Because the dose or the rate of infusion can be adjusted according to the response, and it has a short plasma half-life. Its action can be terminated by stopping the infusion immediately. If there are signs of uterine hyperstimulation and fetal distress, so we can stop the infusion of oxytocin. Another use is in postpartum hemorrhage. It is also used for prevention of postpartum hemorrhage. It contracts uterine smooth muscle, resulting in compression of the blood vessels as they pass through the myometrium, and bleeding is arrested. Next, it is also used for milk ejection after postpartum period. It is also it is given as an intranasal spray, and it's also used for abortion. Now, what are the side effects of oxytocin? The main side effect of oxytocin is uterine hyperstimulation. Overdosage of oxytocin can cause strong uterine contraction, which can result in uterine rupture, fetal asphyxia, and even lead to fetal death. Next side effect is water intoxication. If large amount of fluid is infused along with oxytocin, water intoxication, symptoms of water intoxication are headache, vomiting, drowsiness, and convulsion can occur. And high doses of oxytocin may cause hypotension and reflex tachycardia.